Hi guys, welcome to this lecture. My name is Dr. Achievement. Today I'm taking on pre-participation examination. Okay, because if a patient comes to you, a patient where this is basically for the sports doctors. If a player or an athlete come to you before they will participate in an event, you have to examine them. You have to check if they are fine. If you have to check some parameters so that you know this athlete is able to carry out these activities. So now let's begin. Pre-participation examination is a major tool in injury prevention. The ability is to provide optimal care to an athlete beginning here. Primary objective of this pre-participation examination is to screen for conditions that may predispose a competitive athlete to injury or illness. It is done to establish a baseline to safety, insurance, and reliability. All right. So goals of pre-participation exam. In this pre-participation, we'll be covering the goals. We'll be covering preparation for pre-participation, medical history component of pre-participation examination, and clearance for participation in any sports they want to participate. So goals of pre-participation examination: determining the general health and the immunization process, establish rapports with the patient, detect medical conditions that can be predisposed one to injury or illness, identify health risk behaviors that can be addressed with counseling, establish baseline parameters for return to play decision, assess physical maturities, and evaluate physical fitness. You're evaluating physical fitness, assessing physical maturities, you're checking for the baseline for the parameters for return to play decisions in case the player is out and the player is coming back to participate in the kind of sport or event. You have to check and for the return to play. And guys, I'm taking the topic so fast because I have a lot. I have a lot in this PPT. All right. So goals of the pre-participation examination: make recommendation regarding participation or exercise, meets legal requirements to athlete participation. Before an athlete can be played, they have to undergo this. If you watch in the sports, especially in football, see Ronaldo, if they recess Ronaldo from this team to this other team, the other team who are the buyers will screen this player. They will know if this player is fit to play, especially the common incident. Eriksen, a player from Tottenham. I don't know if you're following football, or if you're following other games, you will know if a player has been transferred to this place. They will be checked for the examination, and sometimes if they come back from injury or if they are coming back from uh some break, some kind of sports breaks are there, so they will be screened to check if they can participate. Other examples: Aubameyang, Christian Eriksen, who had a heart attack when he was playing football for other team in Italy, something so him coming back to I think he was bought in on another team in England. Him coming back to that team in England, they had to undergo some pre-participation examination. So this is a pre-participation examination. Our goal is to goal of pre-participation examination. Specific focus of pre-participation examination varies amongst population. All right, all right. So pre-pubescence, undiagnosed congenital abnormalities, pubescence, maturation level, establishing health behaviors, young adults, history of previous injury, adult overuse condition of predominate. All right, histories should be fed prior to pre-participation examination. Web-based history forms are beneficial for athletes. All right, pre-participation examination, it is influenced by the many factors: levels of competition, availability of the personnel and the facilities, number of pre-participation examination being conducted, personal preference or history. All right, guys, I'm just going fast because I just want to finish this slide so fast. All right. Preparation for pre-participation examination, the format and the timing and the frequency should be noted. All right, so let's start with the format. Primary care physician model, enhanced knowledge of medical history, immunization status, and the prior to injuries that could limit participation. Generally, a more thorough examination afford best privacy and better environment for counseling. Cost, it is expensive. All right. Format group or station model. good for a large number of pre-participation examination is a given time period. Individual personnel responsible for a given element of pre-participation at station, clearance verified by MD at the end of pre-participation, typically free. All right, group station model. All right, group station model is free. All right. So on the timing, it is ideally completed 4 to 6 weeks. 4 to 6 weeks. We're talking about 1 month or 1 month and 2 weeks. All right. Prior to the initial practice, allow ability to prior to the initial practice to the game when the game is coming. Allow ability to address any problem identified on the pre-participation without impending participation status. Typically done 1 week prior to the scheduled activity. A thorough evaluation is important before matriculating into a specific sport, whether at the elementary school, mid school, high school, college, or professional level. All right. In the case of Cristiano Ronaldo, which I used as an example earlier, I was talking about the professional level because these people are the top sports people. Okay. Annual re-evaluation and thereafter often are less comprehensive if there are no changes in athlete health status. Entry level pre-participation examination at the outset of participation for school or organization recommended annual re-evaluation. Annual re-evaluation is recommended. Okay, medical history generally accomplished as yes or no formats. Okay, a supplement form for females is also given. For station model, qualified evaluator must review history and red flag potential concerns for further scrutiny or evaluation. All right, see how the format it is. Though I don't know if this is showing so clear for you guys, but I will not go too much in details, but pre-participation examination, you write the name of the person, the sex, the age, date of birth, grade, school, sports, your address. Okay, so you'll be asking questions like, have you any medical illness or injury since your last checkup or sports physical? They'll answer yes or no. If do you have any ongoing chronic illness? Yes or no. Do you have any hospitalized overnight case? All these things, all these questions should be asked. And once these questions are asked, you'll know if the patient is having any issues. Have you ever had surgery? Are you taking prescription or non-prescription over the counter meds or pills using an inhaler? And all these questions are so crucial to be asked. Have you ever been dizzy during or after exercise? Have you ever had chest pain during exercise, etc., etc.? All right, there's a lot of questions you have to ask the player, and you have to make sure that once you're asking this player these questions, and if they're having any of these issues, you just help them out and treat all these things. Have you ever been told you have a heart murmur? Have you ever had a high blood pressure? Have you ever had racing of your heart or skip heartbeats, etc.? All these questions should be asked. All right. So there is more questions here, but when it comes to females only, sorry for the interruption, guys. Well, when it comes to females only, when it comes to females only, when was your first menstrual period? When was your most recent period, and etc. Some questions that are mainly for females. All right. So in this other part, in the 35 question 35 is asking if you have any appropriate box explain head if you have any pain. They say, have you ever had any other problem? Question Question 34. Have you ever had any problems swelling in muscle, tendons, bones, joints, etc.? If you have any of these problems, you can explain. So you can see here. Do you want to weigh more or less than you do now? Do you want to weight more or less than you do now? So all these questions are there. Pre-participation examination, you use the question, you analyze the patient, and if the patient is having any issues, then you can sort the issues out before the game. And you should not do any mistake because it's relating to a health issues and it could cause some issues to the player if you didn't find out the appropriate answers. All right, most players will just try to hide some things, but you have to do some checkup. There are some tests. Physical examination is there. You have to do the physical examination. After you have taken the data of the patient, you analyze the eyes, you check the lymph nodes, you check the pulse, you check the lungs, abdomen, genital, for main skin. You check the neck, back, check for pain, palpation, and etc. All right. Cleared without restriction. All right. Once you've complete. All right. Let's just. Okay. Here is for the components of pre-participation examination. What are you checking for? You're checking for the vital signs, you're checking for the medical problems, you're checking for the cardiovascular, you're checking for the pulmonary, you're checking for the musculoskeletal, you're checking for the neurologic, you're checking for the eyes, you're checking for the dental, GIT, genitory, urinary, you're checking for the dermatologic, you're checking for the health related disorder, you're checking for the lab test. All right. Lab tests, different kind of blood tests are there. Dermato, the skin, heat related, genital, urinary, kidney, and the rest of them, pulmonary, lungs, musculoskeletal. Okay, now come here for the vital signs. What are we checking for the vital signs? We are checking for the height and weight. We are checking for the pulse or respiratory. The respiratory 60 to 100, and the pulse 60 to 100. The respiratory rate should be at least 13 to 16 minutes. Okay, observe quality and quantity. You observe the blood pressure. Blood pressure should be at least 80 to 120. You check for the body temperature. All right. Moving to the general medical problems, we're asking questions are asked regarding currently being treated for illness or injury, hospitalization or surgery, progressive disease, e.g., cancer, MS, um, current or of OTC, allergies to food, medicine, and environment. Okay, we're checking for all this. So now cardiovascular examination done in the quiet area to examine the validity, occultation of the heart sound. Questions should be asked regarding fainting, dizziness, shortness of breath, chest pain, exertion, palpitation, tachycardia, dysarrhythmias known as momos, dysarrhythmias known as momos, family members with sudden cardiac death. You ask them if there is any, so that you keep in mind of all these parameters so that you could help the patient if the patient is having any of these issues, because most of them having these issues is not advisable to participate in the sports. So we have to clear all these things that show, okay, now 100% this patient is fit, 100% this patient is able to participate on these issues, and if the patient have any issues in the nearest future, we know where it's leading to, if there's any family history or something like that. Coming to the pulmonary examination is done in a quiet area to maximize validity. Validity means to maximize the result if it's true or false, so that the patient will not be in hyper some kind of mood when you're doing that. You're checking for acquisition of breath sound, looking for the symmetric movement of the diaphragm. You're checking for the questions actually as relating to a coughing or after coughing during the activity or after the activity. You're asking for asthma, bronchitis, allergies. You're asking for usual breath sound during or after activities, and you're asking for collapsed lungs. If the patient have any history of collapsed lungs or history of asthma, bronchitis, or allergies. All right. Musculoskeletal examination, we're asking for the range of movements, we are asking for the strength, we're asking for the special test, we are asking the patient injury, time frame, evaluation, treatment, and rehabilitation, use of the protective device. So all these are being asked during the range of motion musculoskeletal examination. The neurological examination, we're asking the patient consists of the cranial nerve testing. Cranial nerve testing expose patients to know the 12 pairs of cranial nerves. All right. Cranial nerves, the pupil function, sensory, We are checking for the motor test of the upper limb and the lower extremities, DTR. We are checking for questions asked regarding HO, history of head injuries. If the patient have had any history of head injuries before, we are checking for the numbness, tingling, loss of motor function in body. We're checking for seizure, boner. Sorry for this disturbance, guys. We're checking for the seizure, we're checking for the bonus, we're checking for the stingers. All right. So the eye examination visual acuity using the SNES charts, both monocular and using corrective lens. We're checking for Emetropia, we're checking for hypermetropia, we're checking for myopia, we're asking questions regarding use of corrective lens or type, we're checking for blurring, double vision. A player who is having either myopia or blurring vision or double vision, the patient cannot be able to play nicely. So you have to check for this because most of these things, if they're having these underlying health issues, it will decrease their performance in participating in the um in the game. So we have to check for all these. All right. So we are checking for the trauma. We're checking for the trauma. We're checking for the retinal detachment and etc. Okay, guys. So dental examination allows opportunity for dental mold to be made for crafting or custom mouse guide. So dental examination. All right. So GIT examination of the digestive system, eating habits, nutrition. All right. Evaluation done in the supine position for palpation of masses of or organ organomegaly. If there is increase in GIT organs, megaly means large size. All right. Questions are asked: history of heartburn, digestion, diarrhea, constipation, organ injury, etc. of that. GI to urinary examination, genital urinary examination. Uh, for mass question asks regarding hernia, testicular torsion for males, menstrual cycle pregnancy for females, and bladder UTI disease. Depending on the kind of sports the person is participating on, you have to know if there's UTI disease, especially if the sports include something like swimming. It could infect others and it could affect the patient's performance, urine analysis, protein, blood, sugar in urine. All these should be assessed. Dermatology examination, we are checking for the skin evaluated for the rashes, lesion, acyania infection that can be con contagious to others such as herpes, fungi infection, impetigo, STDs. All right. Existing blemish should be examined, what more etc. for a change in their size or shape or colors. Alright. Examination for heat disorders. We are checking for heat. Question should be asked according to history, H/O, history of heat illness, cramping, syncope, exhaustion, stroke. We are asking for current medication, diuretic, or sorry for the disturbance once more, guys. Asking for diuretic or antihistamine, or right, use of caffeinated alcohol beverages, nutrition or hydration status. So the laboratory tests that are there, we are doing the urine analysis, we are doing the blood examination, ECG, all right, to check if the patient is stable. So Clearance. Clearance for participation. Condition to be met prior to the clearance will be increasing the risk of injury to individual or others. Can participate can participation be allowed if medicines or rehab or protective braces or padding is used? If so, can limited participation be allowed in interim? If clearance is denied for a particular activity, can some other safe activities be identified and clearance be granted for them? So, you know, after this condition, we have to give these patients a something called clearance to participate as the sports therapy. If it's a sports, because the sports team will come to consult us, clear this patient if the patient can participate. So we have to examine everything safely to in order to issue this clearance. Because if we didn't examine safely and we issue the clearance and the patient go there and have some issues that will affect the game, the 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 investment to the team, they might lose their financial their money, or they might lose the game, affecting their finances, or the patient might have some issues leading to a very severe way where the patient can collapse in the field, or a lot of players used to collapse in the field and etc. And that is not good to issue a clearance when you didn't assess and know what is going on in the body of this patient. So individuals have rights to participate in any activity regardless of pre-existing medical condition. They have rights, but depending on the physicians cannot exclude individual from participation. He can only recommend. All right. We are here to recommend. We can't exclude. All right. But we can tell the team what is going on with this patient, and you're not allowed to play him right now. Some games, like let's say the cricket, or some games like let's say the football, some people have bones fracture or something. So after examining in the musculoskeletal and you notice there's a bone or there is a fracture, then you have to exclude this player, saying that no, you can't participate at this right time, but you can still participate after you get better. Because right now, if you participate, you hurt yourself more. I don't know. There's some cases relating to asking the player to go for surgery and some other stuff. And most players are they have their decision to make, but it's better for players to hear the sports um, therapy who is advising. So conditions that contraindicate sports participation: active myocarditis, precarditis, carditis, hypertrophic cardiomyopathy, severe hypertension. In these cases, you should not participate. Poorly controlled compulsive disorder, no artery, um, s- s- um, swimming, weights or powerlifting, strength training, or sports involvement, height. Recurrent episode of burning, upper extremity pain or weakness, episode of transient quadriplegia until stability of cervical spine can be assured. Sickle cell disease, eating disorder, organomegaly, especially in liver and spleen. So medical disqualification and medical disqualification and decision. Uh, so, pass or conditional, no reservation, cleared for all activities and all level of exertion, no current or pre-existing medical history, no contraindication for collision or contact sports, pass with conditions. Some medical examination or decision is the decision we sports physiotherapy are going to make. All right, we are going to write it in this kind of format. In this, they said pass. Look how it's written. They said pass with conditions. Some conditions have some medical problems that need follow up. Able to participate in the sports at present. Follow up must occur before athletes' participation. Pass with reservations. No collision sports. No contact sports. Okay, so some will be like, okay, this player has passed, but he should not go for collision or contact sports. Why? Because musculoskeletal issues might be there, head injury might be there. So, if you're having head injury, I don't think they will be writing you pass. Fade with reservation. Fade with reservation, not cleared for request activity, may be considered for other sports. Collision not permitted, contact limited, contact not permitted, non-contact sports allowed. Fade with conditions can be reconsidered after medical problems is addressed. Fade unconditional, no reservation, cannot be cleared for any sports at the level of competition. So this is how it's being written by we sports physiotherapy. And mostly we are sending to the team because if you send to the player will just bypass it. The player just wants to play and make more money. The team should be the one to decide. Most times we advise the player you have to do this, you have to do that, and we send to the team. Then they have to decide themselves. We are not the one making the decision for them. All right, guys, this is the topic for pre-participation examination, sorry. And I just rushed it to this point and it took me almost 30 minutes to complete. Thank you for staying. If you wish to see more videos, you can just check my um, profile and you see I uploaded more videos regarding um, physiotherapies, regarding sports therapy. Have a very nice day, guys.